The American Academy of Pediatrics, some of their committees published in their official journal that there's no place in the diet of children and teenagers for energy drinks. Between our study, that recommendation, and later the American Medical Association officially saying these should not be marketed to people less than 18, there was actually a significant fall in the number of calls to poison control centers. We reported that. We thought that was good. Educational intervention actually has an effect. Families can talk around the dinner table with their kids about this, and teachers and coaches and others become more aware. Sadly, over a 3-year period, those were short-lived. They were not sustainable. And our concern is that in the absence of child-safe packaging, in the absence of real warnings about the health consequences on labels, in the absence of sharing this information with consumers, and in the presence of actually having these adverse events where you can't identify every high-risk group, this may be safe for the majority of people who consume it, but until you can identify who really may be at risk, we do try to protect the health of children. It's still sold in some school cafeterias and vending machines in school. There's no restriction on where you purchase or where you access. So we do regulate for the benefit and health and safety of children, cigarettes by tobacco restrictions, alcohol by having restricted sales of beer, wine, and hard alcohol, driving automobiles below a certain age. And this might be one of those areas where, again, just voluntary educational efforts don't give you a sustainable improvement. Packaging, if they're to be sold to adults, could be improved to protect children, but at the same time, this is not something where, again, the largest organization of child health providers in the world, the American Academy of Pediatrics, has already said there's no place in the diet, and this is something where, again, regulations may lead to better health. As a child health care provider for many years, and as a parent of 4 children, and I've had a lot of experiences where a lot of environmental exposures may have unintended consequences. And part of what our approach has been is you let the data really drive the discussion. And so if you don't look, you don't know. And there are safety signals that have come up in over 5,000 humans in the United States over a 3-year period. And what does that say to us when over half of them are under 6? It doesn't much matter whether it's a small company, a big company. As child health providers, as parents, as caring citizens, it's one thing if it's a risk and balance. If this is cancer chemotherapy and it's important to save a life, there is an acceptable level of toxicity you're willing to take. But in the absence of a therapeutic benefit and actually having a risk and you can't identify who's at greatest risk, this is where it just makes sense to protect children from untoward consequences.